Picture this: doctors in 1915 are literally starving their patients to death, and it's considered the best medical treatment available. We're talking about children wasting away to skin and bones, and their parents thanking the doctors for it. Meet Frederick Allen and Elliot Jocelyn, America's leading diabetes experts before insulin existed. These were quack doctors. They were Harvard-educated physicians treating desperate families whose children were dying from what we now call type 1 diabetes. Without insulin, a diabetes diagnosis was essentially a death sentence, usually within months. But here's where it gets absolutely wild. Allen and Jocelyn developed what they proudly called the starvation diet. They would take diabetic children and adults and restrict them to just 450 calories per day, that's less than 2 slices of pizza. For comparison, a typical child needs about 2,000 calories daily. These patients became walking skeletons, so malnourished they could barely stand. But their blood sugar levels would drop just enough to buy them a few more months of life. Parents would watch their children waste away, hoping against hope that some miracle cure would arrive before starvation claimed them. The most heartbreaking part? Some patients did actually starve to death on this treatment, but it was still considered their best shot at survival. Then in 1922, insulin was discovered, and within days these skeletal patients were eating full meals and gaining weight. The first insulin patient, Leonard Thompson, had been surviving on this brutal 450-calorie diet when he received that life-saving injection. So remember, next time you complaining about your restrictive diet, at least you getting more calories than a diabetes patient from 1920.